A winter COVID-19 surge is underway. Hospitalizations across the country recently rising at least 20%. This was just in the past 2 weeks.
That's right. And here to discuss is President of the American Nurses Association, Dr. Ernest Grant. Dr. Grant, thank you for being with us once again. It has been 2 years and counting for nurses there working the front lines. And now we have this new variant spreading like wildfire across our country. Give us a sense of what the situation is like there on the ground for nurses right now.
Well, first of all, thank you for having me. When I speak with nurses across the country, they are totally exhausted, both mentally and physically, from all the hard work that they're having to do. A lot of nurses, if they're lucky, they maybe will get 1 day off a week. The 12-hour shifts that they're working easily turns into 13, 14, or 16-hour shifts. So you can imagine how very tolling that can be, not only on their body physically, but also mentally as well.
You talk about the toll there. It's enough that some are leaving the profession. We've talked to you here previously about a nursing shortage. How are we doing on that now, and what do you think what we're going to see in the near future?
Well, unfortunately, we have had more nurses to continue to leave, mostly due to the fact that they are, suffering, mental health issues, mainly just a total exhaustion as a result of, having to work so long. But we are hoping, that more nurses are wanting, or more individuals are wanting to become nurses. And, but of course, there's a backlog at nursing schools. So it is still going to be on the average of about 2 to 3 years before we're able to replace the number of nurses who have, who have left. Not only as a result of the pandemic, but there was a nursing shortage prior to COVID coming to our shores as well.
And now, of course, being exacerbated. I'm curious, Dr. Grant, how concerned you are about the situation currently right now in hospitals, not only with this Omicron variant circulating, but also with the flu virus. This is flu season. What is your level of concern about our capability to handle all of the incoming patients?
I'm very concerned about that, just as you pointed out, not only with the current Omicron virus, but also the flu virus, since their symptoms are the same. And as Americans, we've sort of let down our guard a little bit. As the country began to open up, we have not washed our hands as frequently as we were a little over a year ago. We're not waiting the 6 feet apart. Some people are still not wearing their masks. So all that sets up as a perfect environment for not only the spread of the Omicron virus, but also the spread of the flu as well. And another big concern is, of course, healthcare workers themselves who may get sick and have to be away from their work environment for up to 10 days to 2 weeks as well. So that will further contribute to the shortage, the workforce shortage that we are experiencing.
And Dr. Grant, a lot of headlines have been made about the behavior of passengers on planes and how they treat flight attendants who have been subjected to some abusive behavior. But this type of stuff is happening to our nurses as well?
Yes, unfortunately it is. We get reports frequently about nurses being attacked either by patients or their families, or sometimes by their colleagues. And there's really no cause, for this. We are, trying to do our best to take care of the public. So to be assaulted, even on top of that, just makes for a very hostile work environment. And we encourage nurses to, to know what their employer's policy is regarding workplace violence, and of course, not being afraid to report it when they, when it does happen to them.
Well, we were just shaking our heads at the thought of that even occurring, given all that these nurses do and continue to do for those of us who come into that room, those emergency rooms, expecting to get the best of care. So that is just a horrific thing to think about. What needs to be done to boost recruiting for nurses? I mean, what you just lined out is a pretty difficult, dire situation for people to want to enter into. But what can we do to encourage more people to step forward to become nurses?
I think the most important thing is, obviously, we do need more funds put towards nursing education, so that people who would like to be nurses that maybe would have to work as a result of work and go to school, the fact that if they can get scholarships and not have to worry about working, that's one good thing. Of course, we also need money for nursing faculty, because the average age of the nurse at the bedside is about 56 years of age. So you can imagine what the average age of the faculty person person may be as well. So we need to get new nursing faculty and also clinical sites. That too dictates how quickly we can get people out into the nursing workforce, is the amount of hours that they spend training to become a nurse. And if there's not enough clinical space for that, then that also will impede the ability of them to be able to graduate successfully from their programs.
And Dr. Grant, just here finally, something heartbreaking Robach and I saw on Good Morning America piece in which a nurse at the end said, "Why are you doing this to me?" Essentially talking about people who are still not washing their hands, doing what they're supposed to do, and the unvaccinated. It was just heartbreaking to hear her say that. I know you'd like to give a message. You talk to so many nurses day in, day out, but a moment now to talk to even more, to give them a message maybe of hope and a happy holidays as we go into what's going to be a trying time for a lot of folks.
Well, thank you for that opportunity. And for my nurse colleagues, I would like to say that we very much appreciate all that you are doing, and that we hear you, and we will continue to advocate on your behalf. And hang in there. Hopefully, this situation will come to an end. And God bless you for all the hard work that you are doing.
Well, we certainly echo those sentiments as well. President of the American Nurses Association, Dr. Ernest Grant, thank you and happy holidays to you and all that you do.
Thank you, and happy holidays to you both.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.